I'm Tim Miller, and podiatrist practicing in Orlando, Florida. And so what we're doing here is that we're trying to start this podcast where we're just giving people this realistic view of what podiatry is, what podiatry is like. And this came about, I don't know, probably what, 2 or 3 months ago,
At
right?
least, yeah.
Right. So we had a meeting. We're looking at ways to just give a spotlight, give a positive view on what our profession is, and let people know what we do. There's some misconceptions about podiatry. There's some ideas that people think of what podiatry is, but we wanted to start this just to get people to know what we do and why we're here and how. I think we're important, but how important we truly are to the medical profession. So I think it's just really cool. So I'm joined in this podcast. I have Dr. David Schweibish to my left. He's a lefty, so as you can see that, so he had to sit there because he tends to use his hands a lot and didn't want to smack me in the face. And then I have
That might happen anyway, just so you know.
I hope you do, buddy.
The
double
smacking
fist
hand
bump.
is the right hand.
So good thing is that I actually am ambidextrous, so I can smack you right back. Dude.
I'm in trouble.
So,
All right.
nah, you're never in trouble, man. You're too good looking to be in trouble. So,
Nice.
and then to my right is Dr. Edgar Sy. So what I'm going to do is I'm going to have Dr. Sy go first. Can you give a little bit about yourself, buddy?
Yeah. No, thank you for having me.
I'm not having you. You're having us, buddy.
No, I don't know. But yeah, Edgar Sy, practice in Miami, Florida. Just finished my fellowship in Chicago, which is kind of cool. So it's nice to be back in the Sunshine States.
Mhm.
Missed it. Now currently working as a surgery professor at Barry University. Interim residency director at Jackson North. So some exciting changes,
Awesome,
and I'm excited. Yeah.
Cool.
You're going to be a busy guy.
Busy guy, I know.
Yeah.
I know. I learned to kind of say yes early on my career.
Yeah.
Opportunities, doors. Sometimes the train doesn't come around twice. I've
Yeah,
learned in life.
Absolutely, man.
So even things like this, I'm just super thankful, super blessed.
That's awesome.
So I'm excited, nervous, but like anything in life, you kind of have to just take it a step at a time.
Dude, honestly, like there's an art to saying no, and there's certain times you're going to have to say no because you're going to get yourself burned out. But I mean,
Yeah.
you're setting yourself up. I think what you're doing and how you're pushing the profession forward and showing people what we can do and what it's really like, as opposed to misconceptions, I think it's just something that's great, man.
Oh,
Listen,
yeah.
you're a great looking dude. You got a fantastic haircut. You're doing good things, man, and I'm proud of you. So
Thank
I'm
you.
really proud of you.
Thank
So,
you. Yeah. Thank you.
hey,
But you
buddy.
want me to talk about myself?
Well, I mean, listen, I know you are quiet over there, but I really want you to
Yeah.
talk about yourself.
Okay, well, we'll get to your foot fetish in just a minute, but that's all right.
Shut up.
No, my name is David Schweibish. I am also a practicing podiatrist. Interestingly enough, I'm joined by a couple of other podiatrists, so this is really interesting how we're all in the same room together.
Yeah,
But
real talk with foot dogs,
yeah,
right?
real talk. Yeah, but I practice in Brevard County, Florida, about an hour and a half or so east of here, with my wife.
Cool.
I actually have to work with my wife on a day-to-day basis, which comes with unique challenges, but a lot of blessings at the same time. So we have a good time with that.
Good.
I found myself into podiatry because I was fascinated by it. And I agree there's a lot of misconceptions. So I'm kind of glad we're here to talk through some of that and try to figure out the whys and the whats of what we do.
Yeah, I think that's awesome, man. And I actually work with my wife too. So we
That's
both,
crazy.
it's podiatry. Podiatry likes to inbreed. And I've realized
It
that a lot of
does, it does,
podiatrists, there are a
it
lot
does.
of podiatry couples that go through.
Mhm.
They meet in school, go through the process together. My wife and I did residency together. I know you guys did residency together too.
Well, we're high school sweethearts. My wife and I have been
dude.
together, man,
Dude,
almost
that is
23,
awesome.
24 years now.
That is awesome.
23
man.
years.
Yeah.
That is
Wow.
crazy.
It's longer than my barber.
That's what I'm telling you, man. It's crazy.
That is awesome. Congratulations.
Dude, that is
That's-
awesome, man.
Yeah. We'll see if I can get another 23 out of her.
You're going to
Yeah.
be. You guys are awesome. You guys.
10-year anniversary next week.
10-year married. But
Married
good.
married
That's awesome.
anniversary. But yeah.
That's awesome, dude.
Yeah.
That's
Good.
awesome.
During the summer conference.
It is.
Yeah. So
Next week.
I
Bonita
plan on-
Springs.
I'm gonna crash your. My wife and I are gonna crash your anniversary dinner.
You probably would.
Yeah, because that's what
I
we
can
do.
see you doing
That's
that
what
too.
we do.
Yeah.
So
At least we like
we
you
love
guys.
each other.
We
Come
do.
on, we're
we
fine.
do. Yeah.
yeah.
You're not telling everybody we're really good friends. That's
I
the
know,
thing you're
yeah.
missing here.
Well,
but-
and that's part of the reason that we're doing this as well too, because we are really good friends.
Yeah.
And one of the things I love about the profession is that we're all tight knit, right? So it's a small community, but it's a community that really pushes things forward. Again, I keep saying that because I really truly believe it, that we are vital vitally important to the healthcare field. And that's where we're coming in here for people who may not know what the podiatry field has to offer. That's why we're here. We want to make sure that we're getting you in the know on what we do, on how we do it, why we do it, and how we can help you. So, so today's real goal is to make sure that you understand and know like who we are and why podiatry is what it is today. So I think let's kind of...
That's a loaded topic, Tim.
Come on.
You think we can do that in what, 30 minutes,
30
40
minutes,
minutes,
whatever.
maybe?
I think the way that we're going now, it's going to be like over an hour talk.
Probably.
You know, while we're talking about that, I just want to give a shout out to Orlando Productions, Doug Loran. Doug Loran has this whole setup here. He's really helping us get the podiatry word out there. And so I just want to thank him. Doug, shout out in the back. You're doing great. We love you, buddy.
Slim. We get asked this a lot, you know, and it's probably like, how many times, at least for me, go on a date like, oh, so do you have a foot fetish or podiatry? But like when we started, like, what got you into podiatry? Like, why podiatry? What made you? I know Dr. Schweibish, you kind of alluded to it a little bit earlier, but yeah, why podiatry?
I'll tell you, you know, so my route to podiatry was a little different than pretty typical. I think, you know, a lot of people find themselves going into an undergraduate major that's science oriented. That was not me. I mean, I studied psychology, I studied philosophy, I studied business as an undergrad, and then came out, went to business school, earned an MBA, and then was working in real estate at the time. And that was right when the recession was kind of hitting, 07, 08, and had to change gears and found myself talking to my wife very seriously about what kind of things we want to do in life. She was always headed down the medical road, had an interest in multiple different types of specialties. Next thing you know, she and I are kind of looking forward on a path that was very similar, and we fell in love with podiatry. We shadowed some docs.
Like you fell in love with each other?
We did. We did. And actually, one of our good colleagues, Dr. Larissa Schmidt, her parents are both podiatrists, got to spend some time with their parents, her parents rather, and found that it was really something that had a calling for both of us. I mean, we just really loved the diversity of the specialty, all the different avenues, different things that we get to deal with, different pathologies on a day-to-day basis that I think a lot of people don't understand. I mean, we are podiatrists, we're foot specialists, but that's so all-encompassing. I mean, we're sitting here talking about dermatology, we're talking surgery, we're talking about kids, we're talking about older people, we're talking about diabetics, we're talking about orthopedics, talking about nerve-related issues. So never a dull moment. And I think that all of that diversity in what we do and the ability for me to also be a little bit entrepreneurial about what we're doing, that was the appeal for me. That's what drove us there. So.
Nice. Do you have like a favorite pathology you like to treat? Is there like, I know we there's so many, like, I love how you said that. You're right. Cause you know, when I tell the students, it's like, or especially pre-medical students, I'm like, hey, like we're dermatology, we're radiology, you know, we have to read that. We're orthopedics, musculoskeletal, so a variety. So is there like one that you really enjoy?
You know, I find myself, I think if I had to really pick apart one thing that truly I think fascinates me and also gets me a little bit excited, it's actually nerve pathology. Weirdly enough, because of how differing it presents and how a lot of people struggle with pain with it and trying to find solutions to their problems, seeing if there is an underlying musculoskeletal issue that can be remedied, whether non-surgically or surgically, different medical or pain management options, and all the different little roads we can go down in that world. And I think that also the complexity of it and the fact that there really aren't clear-cut roads to improving your symptoms, that puzzle aspect of it to me is kind of interesting.
Roads? Where we're going, we don't need roads.
We don't know. We don't.
Back
to the Future. 88 miles per hour.
I'm such a huge Back to the Future fan. Sorry, when you said that, I had to go with it.
You're right.
So
you know what's funny is, and with nerves, like it's funny because with podiatry, you know, then you start asking like, hey, do you have any lower back pain? It's like, why is a podiatrist
all the time,
asking me this? And it's like, well, you know, your lower back is supplying your, you know, and then they're like, wow, I didn't know that. Or it kind of just shows to you how much encompassing you have to know. And then like people with rheumatoid arthritis, right? And that deals with a musculoskeletal deformity. And then it's like, oh, like you guys know about that? It's like, yeah, like it affects the feet.
I mean,
absolutely.
How many times you see patients, they've seen multiple other doctors, different providers, not just podiatrists, but every specialty under the sun, and they've had that same problem. And a lot of times they'll come to see a podiatrist, and all of a sudden all the pieces kind of fit.
Absolutely.
You're like, I think we got to the bottom of the root of your problem.
I think I order lower lumbar MRIs 5 or 6 times a week.
Easy. Yeah.
I just had one yesterday that literally bilateral foot numbness, sharp shooting pain, and a lumbar MRI, multiple stenosis, multiple impingements, and she was like, finally, somebody has figured out why. After she's been to multiple different specialties. So it's something that, as podiatrists and in podiatry in general, that people think we're just focused, that foot fetish thing, right? Mm-hmm. That's not what it is. It's really, even though that's what we're trained in lower extremity and anything, foot, ankle around there, we are overall encompassing holistic doctors, right? Exactly. Because we know I've had patients that come to me that complain of swelling in their legs. Well, I'm the one that's ordering the blood work and diagnosing them with potential liver, kidney, cardiac issues, and then that's when they're like, oh, well, now I set them up with other people where they're now fixing that, because so many medical issues manifest themselves in the legs, right?
Yeah.
In
the foot bone is collected to the knee bone.
Yeah, exactly.
Kind of
right.
I mean, it's all interconnected. It really is.
It's cool, man. It's awesome.
Yeah. I think we as podiatrists do a pretty good job of having that more holistic approach and trying to focus on nutrition, thinking about exercise, thinking about all the orthopedic problems, and you've got to think through it, because a lot of times if you don't get to the bottom of it, you're not going to get success in what you're trying to treat.
So. Yeah. No, I agree 100%. Nerve problem. Good to know. Any nerve complications, I'll send to you.
Not all of them. Not the ones that, if you can't solve it, Edgar, I think then we might be in trouble.
So that's
especially
awesome.
If they're coming from Miami, man.
From Miami, yeah. So, what about you, Dr. Miller?
So, first of all, you call me Tim. You shut your mouth.
I know it's like just
it's weird. I know.
Habits.
So it's
Habits.
So it's funny when the students, and kind of back to the whole podiatry in the field, how we uplift each other. And how it usually works is first 2 years is basic science at Barry University, at least. Third year you get your white coat and you're in the clinics. Okay. I know sometimes other schools you get your white coat first year, but it's your first time out. And when I'm in the clinic with the students, I usually call them by their last name pretty immediately. I go, hey, doctor, this. And I see their face, so even in front of patients. So for me, it's always a habit. But you're right. I always just try to remind them, and so it's like a habit, formality.
No, well, I appreciate
that. Or my mom would get me the chancleta if I called my friends' parents. So I kind of learned at a young age. So anyways, but
well, so mine's a little more traditional than Dave's. So I knew I wanted to go into medicine. Mm-hmm. My mom was an ER nurse for a really long time. She would come in and she would tell me all her stories. Like, she's had some of the craziest stories. She had
in the ER, of course, man.
Dude. So she was in Queens, and New York is just a whole different ballgame, like Miami, right? Yeah. So she had stories where on a bet, a guy put a cue ball from like a pool table in his mouth just to see if he could fit it. But what happens when you overextend your jaw will clench and clamp. So he got it in, but couldn't get it out. So like she would tell me the stories about how they had to, sedate him in the ER to get it out and all that stuff. And I had things happen to me. There was one time I was a football player in high school and in college, but in high school I used to wear contacts. And I got poked in the eye, and my contact rolled to the back of my eye during a football game. I had to go and get my eye relaxed and have the contact pulled out, all this stuff. So but she would come back with all these crazy stories, and I'm like, this is awesome. I'm like, and I'm like, in my head, I'm like, I'm going to be the next House or all that stuff. I'm going to solve all these things, right? My father was a rescue worker during September 11th. So he was a Port Authority police officer. And it's all that day is like, everybody remembers where you were during that day, right? So I remember I was in 8th grade. I was in the cafeteria and I forgot who came in and said that this happened. And actually, the Port Authority Police, their headquarters was in the towers. So my first instinct is like, oh my God, making sure he's okay. Thank God he was off that day. He wasn't anywhere near that. He was based out of Queens anyway. He was based out of JFK Airport. But I remember him going down there and it was like almost 3 months that I didn't see them, that he was there, the rescue efforts, because he lost a lot of people that he was really close with. So it was a really tough time for him. But what ended up happening because of all, lack of protective equipment, they didn't really care. They were just jumping in trying to help. he contracted lung cancer from all that stuff. So he contracted lung cancer that metastasized, kidney, liver, all these things. So I remember wanting to be into the medical field, listening to my mom, but didn't know what specialty. So I ended up shadowing, basically, in essence, going with him to his appointments. And he would have hematology, oncology, cardiology, gastroenterology, pulmonology, nephrology, any other ologies that you could see to try to help. So, and I would see how all these different specialties like worked with each other and how they interacted and how they focused. And I'm like, all right, this is really cool. I'm getting my experience. I didn't find one that I was passionate about yet. I was actually leaning more towards emergency medicine more than anything else with my mom. So and then I went to college and I played football in college. And during my sophomore year on the same play, I was an offensive lineman. My running back got tackled behind me and rolled into me, and I tore my ACL, MCL, and meniscus in my right knee and then hurt my ankle all in the same play. Out for the rest of the season, had surgery on my right knee, didn't need surgery on my right ankle, but I saw orthopedists for my knee and podiatrists for my ankle. And at that point, I hadn't shadowed orthopedics and I had not shadowed podiatry. So I was like, all right, well, I'm your patient now and I want to be a doctor. So let's kind of help each other there.
Let's chat.
So I shadowed both, and it was a great experience there, just having that. But what I saw, one of the things I love about podiatry is that it's really multifaceted. You just kind of talked about nerves, right? You talked about how you're able to see nerve pathology. More often than not, people think of nerves, they think of neurology, right? They think of a nerve specialist, right? People think of skin things, they think of dermatology. People think of bone things, they may think of orthopedics, right? But in podiatry, we do all of those. We're focused on a particular part of the body, but in one day in my office, I can see, a tinea, which is a fungal infection, right? Athlete's foot, right? Mm-hmm. I can see a heel fracture or an ankle fracture. I can see nerve pathology. One of my trainings in fellowship, my specialty was nerves. So I do see a lot of nerve pathology. I also see, ulcers or wounds, not healing things there, and that's all in one day. I have this broad base where I see all that. And I saw that when I was shadowing or I was in the office with podiatry. And I was like, oh, this is really cool. And so I applied to medical school. I applied to MD, DO, and DPM and got into all three and chose DPM because I just liked what I could offer. And I thought my goal, and I think medicine now has changed where when people come into an office where a lot of times it's, I'm not the right person for you. Here's a referral or here's a medicine here. Try this, try that, right? And I'm not bashing primary care. I'm not saying anything like that. All I'm saying is that medicine has evolved to a point where it's, let me throw some things and let's see what sticks, right?
Shotgun approach.
And that's okay. There's nothing wrong with it. But my goal once I went into school and to become a doctor, residency and fellowship was that whatever walked into my office, I want to be able to do something with it. Mm-hmm. And I thought podiatry offered that because with, again, the neurological aspect, neurology with it, the dermatology, the orthopedics, the biomechanics. So anybody who doesn't know, biomechanics is the way that you walk. And sometimes the way that you walk, the way that your foot is placed on the ground, that can affect your knees, hips, back, foot, anything there. So anybody who walks in, I felt like I can do something with. And that's what I saw when I was shadowing in college, when I was with that podiatrist in college. And I was like, okay, this is cool. Like I can do that. And that's why I chose the profession there. And that's why I'm try to do as much as I can now to help the patients. Because at the end of the day, it's about patient care. And going back to my dad, I saw when he was treated like a human being and somebody could help him versus being treated like a number. And sometimes, unfortunately, medicine, it's a game of how fast can I treat you and how I can get you out of there, right? And I've experienced it. You guys have, and I have plenty of patients that walk in who've experienced it too. And being able to not do that and be able to do something for them, it's something along the lines of like, okay, I can help you. And that's why I got into it.
You really hit the nail on the head. I think for me, that's a big appeal is that so many times patients walk into our office with pain or a problem and they leave with a solution or pain relief.
Exactly.
There aren't a lot of specialties in medicine where you can actually accomplish that. I mean, dentists, they get that privilege, I think, from time to time. Obviously, some pain management folks, orthos, things like that. But we're really special. I mean, whether something as simple as paring a callus, taking care of a corn or something like that, to different injections that we offer patients, so much pain relief left and right. I think that's very rewarding, at least for me, knowing that I've alleviated symptoms at the end of the day for X number of people.
It's awesome. And it's empowering. And what I think it comes back to is that I know that all the hard work I've put into it is paying off for the patients. And I know that the reason I got into it is still true. And that's when the people come in and they say it works. I'm like, all right, good. I'm doing something right. So, what about you, man?
No, I completely agree. It's one of the professions that patients usually leave extremely happy.
Right? Exactly.
Whether we have like those availabilities. And I think that's the beauty of podiatry and why people could come in is because, when you're in a certain specialty, you're just seeing the same thing. But in podiatry, let's say I have 5 patients in an hour. One could be orthopedic style, one could be nerve, one could be dermatology, one could be high risk foot assessment nail care like a diabetic, and you don't know, and another one could be an ingrown. You got to do a quick procedure in the office. So the beauty is too is like, as a podiatrist, I think the part of the excitement, the thrill, and the happiness is that like you every patient is a different pathology and it encompasses so many specialties.
And every day is different. I mean, you'll get some days where it is a bunch of ingrown nails that we're managing, and then some days it's a bunch of trauma.
Exactly.
Urgent care center, hospital dumping patients on you left and right with ankle fractures and this, metatarsal fracture, you name it.
They do kind of come in waves. It's kind of funny.
When it rains, it pours.
When it rains, it pours.
It does happen. That's so funny that it happens.
Especially with trauma. You'll go like a week or two without it, then all of a sudden like, oh yeah, I sprained my ankle. Then you do an X-ray in the office, and then boom, you have a fracture. And I love that stuff, the challenging, right? They're like, oh, like I sprained my ankle, but then for some reason, my 5th metatarsal hurts instead. And it's like, oh, let's do an X-ray. It's like, yeah, you actually, avulsion or whatever it may be. And it's cool because it really challenges us. And I think that's where a lot of the pride goes. Like, and then the patients are even more impressed. And they're like, oh, wow, like I didn't know that could happen. And you're like, yeah. And that's what we look for kind of thing. So,
and that's kind of going back to what we were talking about before. So when patients come in, right, they're expecting certain specific treatment, but when we are able to offer, hey, I think you may have this, right? So one of the things I diagnosed somebody the other day with rheumatoid arthritis, right? And they never knew. They had multiple joint pain. So rheumatoid arthritis is a part of the arthritis family. When people think about arthritis, they think usually about what's called osteoarthritis, is when the cartilage wears away. But rheumatoid arthritis more often than not is genetic and really affects the joint capsule around there. And the joint capsule is the covering that holds the joint in place. And when they were having these pains and they had these symptoms of it, I was like, well, we need to do some blood work, right? When's the last time you had blood work? And they couldn't recall. And the fact that they came to me and were like, you figured it out. Like, I didn't expect you to be able to figure it out, And I came to you almost as a last resort, saying, F it, let me try it. Let me see what it is. And it's just like, we can do it.
By the way, that was a great breakdown of rheumatoid. I think you should teach my class for that one.
Oh, I'm happy to do it.
That was really good.
I enjoy teaching.
So, they have standards there, Edgar. They got standards.
I'm above the minimum standards. Come on, man. Well, and that's for our listeners, right? That's really the point of what we're doing. This is education, right? We want to educate who's listening of what podiatry is, right? What we offer, why we're here.
Exactly.
So, it's cool, man. It's
super cool.
And I don't think we're going to keep it very superficial. I mean, we've got to kind of get into the weeds. I think we've got a pretty robust thought process about things we want to talk about in the coming weeks and months. And there's so much we can get into.
Stay tuned.
It's kind of, got to stay tuned.
I know.
Not just for us, but the topics too.
Oh, yeah. Obviously.
But no, I mean, really, though, there's a lot to talk about that I think that unfortunately doesn't get unearthed in our field. I mean, we don't need to be super academic. We don't need to sit here and tear apart journal articles to, impress the public about our knowledge, although we could do that. We might need to do that for one episode.
A bunch.
But really though, I mean, to have that conversation about all these different things in our profession, things we see on social media every day. I mean, that's huge right now. So many times patients come into my office and they're asking me about some gizmo or gadget or something on TikTok. And, you don't know. You have no idea. So you're coming into an office expecting that doctor is going to be aware of what it is you're talking about. We learn sometimes through the grapevine about this new thing, whatever it is, that we may not have been exposed to at a conference or in a journal. And then all of a sudden you've got to kind of keep up with this stuff. And that's hopefully what we can kind of paint that picture of here. So,
yeah. No, super true. I feel like I always get like patients with bunions, like big toe pain. They come in with the Amazon strap. And like, I've been doing the strap, doc. Do you think it's going to fix it? And it's like, that's a myth buster. It's like, unfortunately, no, it is not. It's not going to fix it. But you're right. They see it on the social media. And, there's a highly prestigious doctor named Dr. Google, the cousin Dr. ChatGPT, nowadays. And they kind of come in. And that's the beauty too. The patients are coming in. There's more information out there, right? So it's kind of nice.
Especially artificial intelligence coming into the equation. All this kind of stuff is stuff we got to keep up with. And I think, hopefully we're going to do a good job of actually kind of creating some color in things, because at the end of the day, if you don't have an awareness about what it is that we do as podiatrists, what's the point of coming to see us? You got to have an understanding. And unfortunately, a lot of people, are you a pediatrician? Do you see kids all day? Or what do you do? Do you deal with nail issues all day? Is that all you do? No, it's highly diverse. Everything, in that lower extremity is a very complex part of the body, and it merits our expertise.
And we'll be right back after a word from our sponsor.
Dr. Williams got into medicine because she loves helping people. So imagine how it feels when she can offer a same-day appointment to a new patient like Mike, and have his medical history right there on her tablet, with the system capturing the exam findings and plans for care. With collections up and denials down, Dr. Williams can move on to easily identifying other business matters, and she and her staff can even get in a few hours for themselves. Imagine that. ModMed, your AI-powered practice, awaits.
And when you talk, so I got 2 points to what you guys talked about. Number one is when we talk about lower extremity. So the scope of podiatry is different per state. So usually it's state mandated on what podiatry can do, but general consensus overall is below the knee. Okay, so soft tissue and bone below the knee, and some states are allowed soft tissue up to the hip. So that's why, if you're thinking about, should I go see a podiatrist versus an orthopedic or whatever, think if it's below the knee, we can do it. And we're happy to do it, and we're able to do it.
You got it.
So that was point number one. And point number two, to what you were going at, there's nothing wrong going with Google. So I want to make sure people know that a lot of times, I'll go to Google first too, right? If I got something going on, we'll Google it if I'm not sure. The word of caution is that there's just a lot of misinformation out there. And so you are more than able to purchase something on Amazon, try it and see if it works. I get it. Schedules are busy, time is busy, co-pays, insurances, all that stuff. But try something. If it doesn't work, go and see your podiatrist, right? Go, if you're not sure or questions, it's better knowing than not knowing, right? Because you can Google, you can video, and unfortunately, there are people out there that will put bad information on purpose.
You got it.
And it's awful. Do unto others rule. Some people don't follow that, and I hate it, but people do it. And you don't want to make yourself worse. So that's why I highly encourage, if there's anything going on, again, below the knee, come to me.
Oh, that's a good
saying.
I
like that. You got that? Below the knee, come to me. Oh, what's up, man? That's what's up.
He's broke the third wall.
I broke the fourth wall.
Fourth wall.
I'm Deadpool, baby. I'm Deadpool, baby.
Yeah.
Take it easy there, Ryan Reynolds.
I've been told by people I look like Ryan Reynolds.
You do not.
I do not.
Ryan Reynolds is probably going to watch this podcast someday and hear that you were told you look like Ryan Reynolds, and I think he's going to say
$15 per month.
He might see the fade and be impressed, but then he'll see the hairline, he'll see the complexion.
I've been told Ryan Reynolds and Bradley Cooper. Those are the two people I've told.
Bradley Cooper, I could see a little more maybe, but
those are two great looking.
I do. When I told them, I'm like, all right, man,
that's impressive.
I'm like, all right,
that's better than me. I just get Mr. Chow.
Hey, hey.
But
He
you
said it, not
died.
us.
Yeah.
Funny enough, he was, he was a doctor before acting.
right.
Yeah.
So,
Ophthalmologist.
maybe I'm just gonna,
Leslie Chow.
when they redo The Hangover, I'm just gonna put my name in there.
He was great in Community. Ever see the show Community?
I haven't.
Oh,
No.
he was awesome in Community. That's a great show. If you guys have Peacock, it's an NBC thing.
I need to watch it.
NBC could be a sponsor.
Yeah.
Okay.
There you go.
So,
Ryan Reynolds.
but yeah, dude, it's but just overall, I just think like there's, we do a lot. I think it's cool. I think that's one of the things I love about it is that we do a lot. We can help you, and it's awesome. So
Yeah.
So
I agree. I think how I got into podiatry, I don't mean to like get too personal, but
I got personal.
Yes,
You want to hear my
you do.
stories? dude?
yeah, actually, yeah.
I got hella
thank you
personal,
for
buddy.
everything. Thank you, your dad, for everything he did.
Thanks,
Wow,
man.
true
Yeah,
hero.
thanks,
During a time like that, and you being in New York during that time,
Yeah,
this is
no, I
crazy.
appreciate
So
you saying
thank
that.
you.
Thanks,
Yeah. So for me, I was homeless. No one really knows this. I was homeless. I was living in my car. It was a '91 Toyota pickup truck. At that time, I didn't think I was smart enough to be medicine. Funny enough, I used to be a sneakerhead. I used to work at Nike, and we would get a discount, but then I would do instead of the 40%, I would do 20%. I'd keep the 20% just to kind of pay for food and everything like that. I tore my ACL. I thought I was gonna be the first Jeremy Lin, and then that didn't work out. But then eventually things kind of happened in family where I didn't have a place to go, so I lived in my car. And I was studying for the MCAT, the test to kind of get in before podiatry school. I failed twice. The third time I was going to take it, I said, if I don't get a C on this practice exam, I'm going to quit. I really am. But I loved the idea of being a foot and ankle specialist. It meant the world to me. But I just didn't know. I didn't think I was smart enough. The time I took that test, I got a D. It was 4th of July in sunny California. And I closed the books. I said, I'm not going to be a podiatrist. I can't do it. Because there was nights I would just be staring at this. I would stay at my partner's at the time, her rooftop, like her parking garage. I would stay on the roof because the security wouldn't go that high, and that's where I would stay. So then there was one time I was a kinesiology major, and I remember I was shadowing in a PT office, and they were like, "Oh, a doctor's coming in," and they were like really nervous. And when that doctor came in, he had the availability to just make everyone smile, make everybody happy. And I remember looking at him and I was just like, wow, like I want the availability to influence, right? And then just have that power of just being able to smile and make people, like, people are sad when you leave the room because you bring it up. So I picked up the books again, studied. I got like a C minus, and I had about $600, and I used all that to apply for all, at that time, 9 schools. So currently there's 11 schools, but there was only 9 at that time. Didn't get accepted. Immediate emails, no. And the reason why I was thinking about, man, if I get into podiatry school, if I get into this medical school, everybody takes out a loan typically to start your school. And if I get a loan, I could restart my life. No one has to know my past. I get a loan and then I could start over. I was not the most religious person. At that time, me and my family didn't have the best relationship. But then my mom calls me and goes, "Hey, we're going to go to the Philippines. I think you should come." They took the expenses, and we went to a church, and she goes, "This is the most holy church, Our Lady of Manawag." She was like, "If there's anything to pray for, it's now." And I kneeled, and I was kind of rude to God, if I could be honest. I'm not making this religious at all, but I felt like Jim Carrey from Bruce Almighty, like why,
yeah, man, yeah.
So later that evening, I get an email from Barry University saying, "Hey, we've been trying to reach you. We want to grant you an interview." I drop my phone. I start crying. I get to Miami like a week early just to prepare. Did the interview, and they're like, "Why should we accept a student like you with these kind of poor MCAT scores?" And I said, "If you take a chance on me, I promise you it's going to be a great investment. I will give it my heart and soul." Next day, they accept me, and then my life changed.
That's awesome.
So I think from there, I just made a promise to myself to not only help as many people as I can, but just be the best podiatrist I could be, and that would lead to better patient care. And I think when I got the position at Barry University now as a professor, it was like a beautiful full circle, really, because it was the university that really changed my life.
That's
so
awesome.
Podiatry as a field for me allowed me to just have the privilege of living, so to me, I never take it lightly, and that's why I have so much passion in it. It just really allowed me to, I'll always remember the feeling of, being in my car, and in California, we have something called Jack in the Box. They had
Of course, I know Jack in the
Box,
yeah,
right? Yeah. Best, one of the best fast food
horrible.
chains. Horrible for you.
It's horrible for you, but it's amazing.
But then, but sitting up and not being able to, buy food, and that feeling of going to sleep hunger. So that's why too. And with the university, and the beauty of podiatry is like, we do homeless clinics, we do foot washing events and things like that we have the availability to really give back to the community. So besides like patients in a surgical or a clinical setting, like we do have that availability, mission trips and things along those lines, just kind of expanding, right? Some of the things that we know, that we have to offer. So that's a little bit about me. So that's why I love this field, because it just changed my life and allowed me to meet beautiful people like you guys too.
I think we officially have to end the episode. That is
was
very.
heavy, man.
Tim's about to cry. Tim is about to cry.
I'm an emotional person.
Yeah. I mean, and I say that for anybody, and the reason why I say it, not that it's obvious, but like not for pity, but I just, hopefully if somebody's listening to this podcast, I just genuinely hope that somebody knows that, hey, like, give it a shot. And I think follow your passion. And if it's podiatry, it can really change your life. It changed mine for the better. And kind of like we talked about earlier, you could help so many patients so quick. But it can change your life. So I think, and then feet are like the tires of a car.
Absolutely.
If your tires are malaligned, I'm not a car person, I watch Too Fast, Too Furious. That's about it.
There we go. Tokyo Drift, man.
Yeah, your axles, I think, get malaligned, but same thing with your feet, right? You kind of mentioned it earlier, biomechanics. So I think feet is so important.
First off, your story, man, like one of the things that I want to impose based off that, I love that we're talking about stuff like this, is because patients when they come into the office, a lot of times they think that, we're privileged, and that's nothing against the patient, but a lot of times they'll come in and they'll say, well, you're a doctor, you can do this, you can go here, you can afford that. But one of the things I love about podiatry and the podiatric profession is that not everyone, but most of us are humble, right? Mm-hmm. Yeah. We come from so many different backgrounds, so many different reasons why we're in the profession, but it doesn't matter where the backgrounds or the reasons, right? It's at the end of the day, we're here to help, mm-hmm. right? And as such a integral part of the healthcare system of what we can offer, and that passion, that humility is, I really think, sets us apart in the healthcare profession.
Yeah, I agree with you. Yeah, I completely agree. And I see that now, I think, even reflected in the stories that I've heard, not only from students at Barry University down in Miami, but in all the colleges across the country. I mean, you hear people who've come from very humble beginnings or have had very traumatic experiences that have brought them not only into healthcare, but into podiatric medicine. And it's a beautiful thing, because we provide that kind of an outlet for some people to find either fulfillment or to find a career that can provide for their family in a way that very few other things can. And mm-hmm. I feel very fortunate to have, the opportunities that I've had and that have given me the life that I've got today because of it.
Yeah. And you're right. The first advice we get in school was, hey, podiatry is a small world.
Yeah.
And it's cool because, you guys are one phone call away, right? And I could rely on you, and you guys are great mentors of mine. Like, I could call you like, hey, I have this, whether it's patient care, something with my office, something with insurances, or just life, right? And things like that. And I do agree that the professional really allows us to make good connections, for life,
Yeah, but you got to stop texting me at like 2 a.m., man. It's gotten a little...
It gets a little weird.
Much.
Yeah, your wife might start thinking.
That's why you blocked me.
Yeah, you're still on block, actually.
Still on block.
Is he still saved as KFC? Like, why is KFC texting
you? Ryan Reynolds is calling.
Ryan Reynolds / Bradley Cooper. By the way, I got to check your phones after, making sure you don't have me as Mr. Chow.
Mr. Chow,
Yeah. But I did dress up as him in one Halloween.
Yeah.
Oh. Yeah, and I'll put it up there very soon. I'll show everybody. Yeah, and being in Miami. So in Miami, there's a 0.04% of Filipino population, and Asian is actually less than 1. So when I walk in, it's I
All
feel like
eyes
a
are on
unicorn.
you. All eyes are on
Yeah.
you.
So then when I come in as Mr. Chow, everybody took pictures of me.
That's
It was
awesome.
I was like, I feel like a zoo animal kind of thing, but. Or maybe I just did a good job with the costume. Yeah.
that could be it.
Dude, I would have had
Yeah.
no idea about your background, man. So you're
Thank
you're
you.
humble, and and it's much appreciated of
No.
who you are and what we
Yeah.
do, man.
Yeah.
And then just another thing I kind of want to touch on too is just that people think of schooling, right? You kind of talked
Mhm.
about schooling before. So there are MD schools, so that's medical doctor, right? And then there's DO schools, which is doctor of osteopathic medicine.
Mhm.
Some difference between those two, and then there's podiatry school, which you end up with a degree of doctor of podiatric medicine, DPM. So when you are in podiatry school, like Edgar was saying, that those first 2 years are very similar to MD-DO. You're taking general anatomy, you're taking biochemistry, anatomy and physiology, and you go into very similar roles. And a lot of the podiatric schools now are in conjunction with medical schools, MD-DO schools as well, where the classes are being taken at the same time with podiatry. So you're learning the same things in those first 2 years. And that third year is when things start to change. That's when we focus more on the lower extremities. That's when we're doing lower extremity anatomy, and things get really in depth based off there. And after that, there's residency afterwards, where it's a 3 or 4 year residency focused on surgical interventions with medicine as well of the lower extremity there. But during the residency, we're also doing general medicine, general surgery, vascular surgery, emergency medicine rotations, because again, we're all encompassing. Even though we're focusing on the below the knee, we are all encompassing there. We know how to treat, why things are being or manifested in the foot and ankle and legs. So, and then there's a fellowship training afterwards if you want to specialize more. But that's kind of the generalized difference of where we go between podiatry and other professions.
No, I love that. You need to work at Barry University. Yeah, so there.
You ready to hire?
Yeah. There's 11 accredited universities throughout the United States, and for any pre-medical students out there, the average MCAT's usually 490. But the one advice for any pre-med students out there is that typically when we look at GPA, it's actually the last 2 years of what we're looking at. Usually it's like we break it down from the last 2 years GPA, then we look at the last 2 years, which is typically your science GPA, which usually averages like a 3.37 or a 3.2. And it's great too for any, funny enough, we found this statistic. Women in medicine is very gaining popularity,
As it should.
and it should.
Absolutely.
And right now in the class, the incoming class, we have 22 females, 11 men, and so I think that's also cool. A side note that the podiatry really embraces and empowers women in
That's
medicine.
awesome.
And to piggyback off that, I'm not here to repeat everything you said. You said it very elegantly. Yeah, like
Thank you.
Third, fourth year in school, you get your white coat, and then you start your clinicals. And when we do residency, back to the whole like treating everything, we are doing a residency in foot and ankle, podiatric, surgical, and clinical, and everything like that. But we do rotations with general surgery, orthopedics, plastic surgery, and things like that. So we are. It is a. I mean, you do the council. You're part of the council for the residency.
Yeah.
So I mean,
Yeah.
you have to have it to graduate. So we do rotations that really allows us to take outside concepts, and then like MIS burrs, right? For minimal invasive bunions, that burr, now that foot and ankle is blowing up, that burr was innovated from a dentist.
Yeah.
A high torque, low speed. So they got that from dentistry, funny enough, and we're incorporating other specialties into foot and ankle surgery and medicine, which I think is pretty cool.
Awesome.
I can't wait to have our chats about minimally invasive surgery.
Well, that's going to be
that's near and dear to my heart.
You stay
Yeah.
tuned, my friend, because we got plenty of things coming up. So I think
Yeah.
at this point now, I think that's
One last thing. Just sorry to cut you off really quick, but
You
did
shut
you
your
guys?
mouth.
I know, right? Yeah. Sorry, Ryan Reynolds. Don't go Deadpool on me. But did you guys know that foot and ankle surgery is the fastest growing and innovative surgical specialty out there?
Look at that.
So all these other companies are kind of going in, and because, like, for instance, this discussion is not about bunions, but for bunion surgery, if you go on a textbook, there are over 50 procedures, and if in every surgical conference there's so many. So now with new techniques, but yeah, all these companies are trying to do the next jig, the next proprietary screw, or things like that. And it's they found that statistically it's the fastest growing subspecialty. So it makes it even more exciting to be in this profession, because if surgery is the route that you want to take, right? And if I may, when you do the traditional MD-DO, when you take step one, the one downfall is that you have to score a certain amount if you want to get into that specialty. With podiatry, you pass, and then you have that availability to seek what you want to do, whether it's nerve, be a specialist in the nerves, or plastic surgery, or orthopedics, or trauma, whatever it is. So I do think that's another benefit. You could find your passion and you could go with it much more readily, I guess you could say.
That's a good point. Yeah, you're going to become a podiatric physician.
Yeah, exactly.
That's cool.
Exactly.
That's one of the good things about it too.
Yeah.
So,
yeah.
I just want to thank you both for being here, and I think this is a great way to start things off. There are plenty more topics coming up, and we are here to help the profession. Podiatry is here to help. It's something that podiatrists love doing, and you can see the passion through here. Today was kind of more of the what and the who, and then next up we're going to do the how and the why. So
can I get coffee first?
Yeah, man, I gotta go to the bathroom. So
right, thank you, Ryan Reynolds. I appreciate it.
No, thank you, Mr. Chow. Okay.
Did you die?
What does Dave look like?
Luscious Dave. The hair.
Luscious.
So
David Luscious Schwabish.
I think we got a question from the audience. Where do you get your suits? That's the real.
Look at that.
You are always so honestly. Before this podcast, I knew you were going to dress sharp.
He is the sharpest dresser,
you
man.
You are the most. Yeah.
He
from
is so
start. Yeah, head to toe.
Like jaw dropping.
Yeah.
So I'm not really fixed on any one particular place. I'm big on like traveling and discovering. That's kind of the secret. So, different conferences, different places I go, always trying to seek out kind of little innovative places to find good fashion.
Jack Sparrow. The Jack Sparrow of suits.
But no, I mean, really though. I mean, I think that we, try to we got to keep up appearances a little bit.
Yeah. Do you wear scrubs to the office, or do you dress up by any chance?
So it depends on the day.
You wear scrubs with
it depends on the day, but generally speaking, I usually have my uniform with a white coat, and I do my thing. But no, it's kind of a mix. Yeah. It depends on the day.
Yeah, I dress up. That's why I'm curious. I don't wear like a tie, but I do like slacks or your chinos.
As you should, Professor. As you should.
I'm a scrubs.
Yeah. Scrubs. Yeah.
I honestly, throughout my day, my practice is more procedures in the office, not so much surgeries, but I do a lot of different things in the office, and I have ruined many a nice clothes, many a nice shoes.
Well, you also do some more complex surgical work though. So I think with pin care, with external fixation, a lot of things you're doing, I'm sure you probably have an environment where it's more warranted.
It is, a lot of, even not so much like the extra, but like a lot of like, blood.
Yeah.
So there's a lot of things that fall and all that stuff. So I tend to go more scrubs so I can throw them out.
Yeah. And the devastating betadine, the soy sauce, that'll stay forever.
Dude, that stuff does not get. So anybody who doesn't know, betadine, iodine is all like the same. It's antiseptic. A lot of us use it to try to keep bacteria or infections out. And it
Dr. Schweibish puts it in his fried rice.
It looks like soy sauce, and it just stains. And thank God my office now has a dark floor. Because we had a light floor in my previous office, and you could not get that out, and it would just tinge it yellow, and it was just awful.
You don't know about Betadine?
What's that?
Betadine. It's a solution that you can buy that helps to negate iodine stains.
Way,
it's called
dude.
Betadine.
So I should have Googled that.
That's pretty cool.
It's okay to Google.
So any extern listening, do not get betadine on your attending or your resident, or else it'll stay forever, and you'll not get
have
that
to pay
program.
their dry cleaning bill or buy them something new.
Yeah. New figs.
You want to hear something cute? Just to end the podcast with.
Tim Miller.
So my 7-year-old calls Google googly because of the way it's spelled. So he's like, he'll ask me a question. I'm like, I'm not sure what that is. He's like, oh, just googly it.
Yeah.
Yeah. So it's okay to googly it. Okay.
To googly.
I want to thank Doctors David Schweibish, Dr. Edgar Sy. Again, shout out to Orlando Production, Doug Loran, OP with the OG Doug Loran. Thank you so much. Below the knee, come see me.
Please.
Right? So stay tuned for more episodes. We're happy. Go see your podiatrist. Keep calm, see your podiatrist. Right?